Hello, good afternoon everyone. I'm from Dublin Castle. My name is Roisin. I'll be hosting the webinar today, and today our webinar is on Schwartz Rounds, and really it's going to be an on-the-couch questions and answers session. So we have Joslyn online. Are you still there, Joslyn?
I am. Hello.
Hi. Unfortunately, we couldn't get Joslyn's picture up, and unfortunately she couldn't make it to Dublin today, but she's with us in spirit, so thanks a million for joining. So we've Joslyn, who's the Point of Care Foundation CEO, and she is the lead for Schwartz Rounds. She's an academic lead for patient and public involvement in London and a visiting professor in the Department of Medicine in Imperial College and a trustee of the Nuffield Trust. So thanks a million, Joslyn, for taking the time to join us today. Also on the panel, Also on the panel, we'll have Dr. Joan Cunningham, who is joining us with Anita and Jean Kelly. So Dr. Cunningham is the Medical Director and Consultant in Palliative Medicine in Our Lady's Hospice and Care Services, and she's a long-standing interest in medical ethics. In 2015, Dr. Joan Cunningham was appointed as the clinical lead for Schwartz Rounds in the Black Rock Hospice as part of the HSC pilot, and is now passionate about potential benefits of Schwartz Rounds for healthcare staff. So she's hopefully going to share us some of her learnings over the last year or two with her experience of Schwartz. Also, we've Ms. Jean Kelly. Jean is an interim Chief Director of Nursing and Midwifery Executive Board member at Sailta University Group. She is passionate about nursing and also passionate about putting staff at the forefront, and the wellbeing and support were the reasons Jean got involved in Schwartz Rounds. And then we've got Anita, who is the lead for Quality Improvement Division for staff engagement. Her core focus has been to support leaders to develop skills to engage staff in QI and introduce Schwartz Rounds in a collaboration between the Quality Improvement Division and the Point of Care Foundation. Juanita's work includes the design and implementation of organisational interventions to create cultures underpinned by trust, open communication, value staff knowledge, and the staff voice. So today, really, it's over to you. We do have a number of questions that I have here to ask the panel and to get them to share their experience of Schwartz Rounds, but really it's all about you online and what you would like to know and learn. So as we go through the question and answer session, it'd be really great if we could be a little bit more interactive, and if you could type in the chat box function any questions and answers that you have for the team of speakers. We'll be monitoring the chat box throughout the session, so anything at all that pops into your mind, please stick it in and get a little bit of a conversation going on the chat box. So what we might do today then is we might start, Joslyn, if you don't mind, if you wouldn't mind giving us a little bit of a history on the origins of Schwartz Rounds and an overview of where they came from and who exactly was Kenneth Schwartz.
Okay, thank you. Hello everybody, and I'm so sorry I'm not with you in Dublin Castle today, but I'm really pleased to be able to join from London. The Schwartz Rounds are an intervention to support staff which was developed in the 1980s by the Schwartz Center in Boston, Massachusetts. They're designed to, their purpose is to strengthen relationships between the people who provide care for patients and the patients themselves. And their origins are in the experience of a man who was the legal attorney for the Massachusetts General Hospital in Boston, called Ken Schwartz. Ken was a man who tragically received a diagnosis of terminal lung cancer when he was in his 40s. During the next 18 months, whilst he was being treated, he wrote a paper for the Boston Globe in which he talked about the difference that he experienced when the staff who he encountered whilst he was receiving treatment were kind and compassionate towards him, and kind of recognised him as a person, not just as a clinical condition or a set of clinical problems. After Kenneth
Hello. Hi, Joslyn. We seem to have lost connection there. Joslyn, can you hear okay? Sorry, guys, for those online. We seem to have lost connection with Joslyn for some reason. Fingers crossed that she will come back on stream. But we do have Anita with us. So as I introduced earlier, Anita is the Quality Improvement Division staff lead for staff engagement. Her core focus is to support leaders to develop skills to engage staff, and has been the lead for the introduction of Schwartz Rounds in Ireland. So thanks a million, Anita, for taking time to come up during a very busy conference. So hopefully, Jocelyn, we seem to have lost connection with her, but hopefully she'll be able to dial back in, so we'll keep an eye on that. So maybe, Anita, do we want to do a little bit of an introduction on what the understanding of what Schwartz Rounds actually are? Would that be okay to start with that? I know two of the panel are still busy answering questions downstairs. We're here in Dublin Castle, so maybe, Anita, you could give a little bit of an intro on that.
Will do. And apologies we weren't here at the very beginning. They're still sitting on the stage, so they'll be up as soon as they can. That's the thing about doing a live broadcast. I suppose in terms of Schwartz Rounds, I'm very conscious that there might be mixed understanding or knowledge about Schwartz Rounds, and we could have people online that are very knowledgeable. So I would say to you that Schwartz Rounds, the basic description of it is a conversation with staff about the emotional impact of their work. Very often we're great problem solvers in healthcare, and we try to fix everything. So the minute somebody talks about a challenge or a difficulty, we immediately jump to fix it. And very often it's about the patient or the service user within the service. But in most cases, we never really explore the emotional impact. And within the healthcare system at the moment, there's very high levels of burnout, very high levels of absenteeism and retention. So there's a significant challenge there. And when you begin to explore it with staff, what they see on a day-to-day basis has a profound impact on their lives. And it's not like a typical job where you can go home and you can have a chat about who you met today and what happened and where did you go. When you're working in healthcare, very often times you return home at the end of the day and you can't talk about it because of the confidential nature of the work that we're doing. And that doesn't matter what area of the organisation you work in. So on a very simplistic level, with Schwartz Rounds, what happens is you have a clinical lead and a facilitator in an organisation, and each organisation that begins with Schwartz Rounds trains 3 people, a clinical lead and 2 facilitators to start off with. And there's also an administrative staff member that gets training, because the admin person is absolutely essential for the success of Schwartz Rounds in your organisation. And each organisation will also set up a small steering group. And that steering group has members from across the organisation, because one of the biggest things about Schwartz Rounds is that it's not just doctors or nurses that are involved in it. It's multidisciplinary, it's across all levels. So any staff member who works in an organisation has an opportunity to participate in the round. And the way it works, generally speaking, is that people come together for a lunch break to start off with, because food is very important in terms of looking after ourselves and our well-being. And as an organisation, it sends a very strong message to people that if you're coming in on your lunch break to participate in a round, we want to look after you in doing that. So they provide lunch for people. And the next thing that happens is that everybody comes into the room together. And at the top of the room, you have the clinical lead, and you have 3 or 4 panellists who will sit in the centre between the clinical lead and a facilitator. And those 3 or 4 panellists, they sit in the centre because they're protected on either side by a clinical lead and the facilitator. And then the other members of staff sit in rows, usually in front of the panellists. As I said, those panellists have been pre-prepared. So generally speaking, each round has a particular theme. So a theme could be maybe a patient I'll never forget, or isolation, or a good day at work, new beginning, whatever theme is relevant within your organisation. And the idea is that those panellists will have had an opportunity to prepare a story from their past, not about the patient care, not about the clinical diagnosis, purely about what was the emotional impact for them as an individual? And they have a chance to prepare that. It's 5 to 6 minutes, generally speaking. And what happens is the clinical lead will open up the conversation and welcome everybody. And when they welcome everybody, they have, I suppose, and we've just more arriving now. When they start, the clinical lead will open up the conversation for people and will welcome everybody. Will explain about the confidentiality, because confidentiality is really crucial to the success of rounds. Then you have an opportunity for 3 to 4 of the panelists to tell their story uninterrupted. And then finally, you have a facilitator who will facilitate a broader discussion so that any member of the staff that are there present on the day can participate and can share what's resonating with them, a particular story that comes from their situation background. So that's sort of the summary of what a Schwartz Round is. I'm now going to make a bit more space so that Jean and Joan can join in.
It's very intimate. There we go, guys. So we have a full panel now. So welcome to Dr. Joan Cunningham. I explained who you were earlier. So thanks a million for joining us. And Joslyn's back online. And also want to welcome Ms. Jean Kelly. So thanks a million for joining us. I know you've had a busy session downstairs. So we've just got started. Joslyn, are you back online?
I am, yes. Hello.
Fantastic. We lost Joslyn earlier, so thanks for dialing back in. So, Anita, you'd give us a little bit of a quick recap or run through about what actually is a Schwartz Round, and maybe could we have a little bit more about what actually happens at a Schwartz Round? If anyone else would like to,
go ahead.
Speak to that,
Yes, I suppose the first thing is obviously when the audience or when the staff members are invited to the Schwartz Round, they get a lunch that's part of the meal. They get their free lunch, so they come in maybe to an ante-room or another room before they go into the room where the session is being held. Where I am in Galway, we usually have about 100 people, so we have 2 rooms. So they would come in, have their lunch, and then exactly at 1 o'clock the doors would shut. And the clinical lead, myself, or our other clinical lead would stand up and introduce today's round. And really, my role is to give some of the background information to what Schwartz Rounds is. I talk about Kenneth Schwartz and where Schwartz came from. And also I do a bit of housekeeping, telephones turned off, all that kind of thing. And then the facilitator introduces the panel. And then the panel will tell their story. And then the facilitator, myself, facilitate the next piece of the round.
And this might be a stupid question, but is the story just something that might have happened, an episode or an incident that might have happened that week? Or
no, usually a theme. We just decided on a theme. So it could be, a patient that I'll never forget, which is one that a lot of people start off with, but it's something. No matter where you work in a hospital, there's a patient you won't forget, even if you're not frontline staff, And so it's usually a team because it's well prepared, so you get your stories and you get your panelists. So sometimes if it's something that has happened, particularly in the acute setting, you wouldn't be talking about it then. You would be waiting maybe a period of time before you start talking about that.
That's probably one of the really essential roles of the steering group. It's one of the things that they do is that this was a very sensitive topic and it wasn't a good time to discuss it with the organisation. That steering group provides that insight and that knowledge.
Okay, great. Maybe there might be an opportunity to have a little discussion about the experience today of Rounds in Ireland. I know both of you have come from different environments and might have some stories to tell. And Joslyn, perhaps it might be a nice preamble to give us some history around how Schwartz came around in the UK and how long it's been around and how many sites are using it, etc.
Sure. Do you want me to start or do you want to hear from Joan first?
You can start, yeah, perfect.
We first came across when Joanna, who just walked into the room and left again, I noticed.
You heard you were online.
When Joanna first came across the Schwartz Rounds, which was, I think, in 2008, reading a blog from Boston written by a chief executive of a hospital that was using them. At that point, the Schwartz Center in Boston, which, like the Point of Care Foundation, is a charity, they had helped just over 200 hospitals in the USA to do Schwartz Rounds, and they had already evaluated them, and they demonstrated that they achieved a great deal for the people who attended them. So we were very interested. We went across to Boston, saw what they were doing, and negotiated with them that we could test the rounds in 2 hospitals in England, the Royal Free and Gloucester Hospitals, which is in fact a trust that has 2 hospitals, Cheltenham and Gloucester. And we tested them for a year. And the question that we were asking wasn't, do they work? Because we knew from the American experience that they did work. The question we were asking was, would they work in our context, which might be different from the context of America. To cut a long story short, they did work perfectly well. They were just, in fact, so similar to the rounds that we had observed in Boston that we and the Schwartz Center felt very confident that with what we were doing, really. And in England, they began to spread mostly by word of mouth. So people from the Royal Free and from Gloucester and Cheltenham would speak about the Schwartz Rounds at conferences that the Point of Care was involved with in doing. And at every time we spoke about what we had seen in Boston and what we were experiencing over here in the pilots, we would find people coming forward and saying, I really want to do something like that in my setting. And gradually we just began to help people to establish Schwartz Rounds more or less without a plan. But in 2013, we got a grant from the Department of Health to promote and spread them in a much more strategic way. And that's what we've been doing for the last 4 or 5 years. And we've now got 180 hospitals and hospices and medical schools and some other types of healthcare organisation like call centres, all doing them. And so we're very proud of that achievement, and that 180 includes all the sites that we've been working with you on in Ireland.
Okay, great. And just actually, how many sites are using Schwartz in Ireland out of interest?
14.
Great, okay.
14 at the moment. And when I say 14, there's a number of those that have just been trained, so they're just coming to, I suppose, set up their steering system and get established at the minute. But yes, 14.
Great. Well, would it be nice now at this point, Joslyn, to hear from maybe Jean or Joan a little bit about their experience? Would that be okay?
That would be great, yes.
Yeah.
So I'm from Blackrock Hospice. We're a satellite unit of Our Lady's Hospice and Care Services. So we're a small hospice of 12 inpatient beds and a day hospice and a community team with circa around, somewhere around 60 staff at any one time. And I think we were just in the right place at the right time when the Quality Improvement Division were looking for someone to pilot this with connections at several levels, and we were looking for something to support staff well-being. It was really important to us as an organisation. And we thought we were small enough that we've got this reputation of just trying things, you know, to see if they work on it. I have to be honest and say it, in my 21 years of working as a doctor, it's the most exciting venture I've had the privilege to take part in. It really, I suppose, it's so unexpected, the benefits, both personally and professionally. I think it's created that space that exists nowhere else that I've ever seen, that everyone comes together as equals. It's almost as if you leave your name badge at the door and you come in and there's this space that's really safe to share stories of the challenges we all encounter when we're caring for patients and caring for their families, but also trying to care and support one another and colleagues. I mean, we've been running rounds similar to Galway now for over 2 years, and I suppose some of the challenges we face is the small pool of staff, but there has been changeover. I'm looking at the slide on the main thing of the audience. 6 people in 20 have left either due to retirement or promotion elsewhere, and so there is constantly blood coming in. So you're having to tell people about Schwartz, and you quickly find you become very passionate about it, almost evangelical. And I laugh with Anita that the first Christmas after we had started Schwartz Rounds, my family banned it from conversation because it just takes up so much. I think we had that real sense of privilege that we were part of the pilot site. We quickly could see the benefits for us and wanted it to be expanded nationwide. So that's responsibility, but also wanting other people to benefit from it as well.
There's a couple of practical questions that might fit nicely in here. Now, from Eve McKeown, who's asking around how often do the Schwartz Rounds actually take place and how were the themes decided?
So in Black Rock Hospice, we finished ad every month. And then we went to bi-monthly once we signed a contract, and now we've gone to 6 weeks. And the steering group is key. So these are your group of supporters who are going to help implement Schwartz Rounds, identify future panelists, and also are part of the discussion group as to what is your next theme going to be. So it's almost by consensus of putting ideas forward. And I suppose we're very conscious in Black Rock, because we're so small, that we try and alternate between maybe one of the tougher subjects or things to discuss and maybe a nice softer, gentle one, so that there's not that consistently, oh, this is terrible, how do we all feel? But actually trying to get the balance, and that seems to work for us.
Jean, did you want to share anything there?
Yeah, no, we'd be similar. It's your steering group or, where you decide your team. And then people might approach you, not that often now, but some people will approach you with, a story. And, you bring it back to the steering group, and, lots of people hear things, and no matter where they work in healthcare, there's always stories being told. So they take it and say, oh my God, that sounds really good. What's behind that? What could we, what could we make, what would that look like as a round? So, yes, that's very important. And in Galway, we have them monthly, but we just hold 9 a year because summer and Christmas we don't. So they're kind of spaced out around that.
And maybe as a follow-on from that, in terms of the data, like the evidence to support the how good the outcomes of the Schwartz Rounds are for staff, is there any measurement or anything being done in both of your sites to show that?
Yeah.
Or Anita, if you want to.
Yeah, I suppose to start off with, the decision to do rounds is based on a lot of international evidence, and there's significant data there around the impact on teamwork. And they've just finished a longitudinal study in the UK, and Joan Cunningham is actually here speaking about it today, and they showed that there was a drop in psychological distress in staff who attended over an 8-month period from 25% to 12.5%, which is really significant. So it is having an effect. And here in Ireland, we didn't want to over-measure the sites at the beginning because we said we don't want people to come in and feel they're participating in something. So we small measures that we could do. And each site did their own measures at every single round. And separate to that now, we have an independent evaluation that's being led by Trinity College Dublin, and that's in process at the moment. So we're looking forward to seeing the findings of that when it's complete. But the preliminary data, again, which is presented today, is showing some really positive results, and feedback from staff in terms of the comments. It's showing an impact in terms of the sense of connection to the organisation, the sense of pride, the sense of, I suppose, the hierarchy, that sense of everybody's a professional at what they do comes out really strongly, and that insight into what other people in the organisation do, and tapping into why did I become a healthcare professional in the first place? Is it still the same reason I'm here now? And tapping back into that if it's changed.
A question that fits in nicely there as a follow-on from Angela Teisel is, does the feedback from staff in these rounds feed into other staff support programs? Where does that feedback go?
Roisin, shall I answer that?
Yeah, Joslyn, feel jump in whenever you want. Yeah, thanks.
I'd be interested in what Jean and Joan think as well, but I mean, I think that question is quite complicated because when people are talking in rounds, they're not really giving feedback as such. They're having a conversation with each other about their experience. And that, I think, isn't the same with staff feedback. But at the end of the round, there's always an evaluation, where people say how they felt about the round, which is feedback, and that is relevant and I think worth connecting into other efforts in an organisation to support the staff, because the Schwartz Rounds are one type of support and intervention. They're not the only type. But I think the other thing is that there are always issues that come up in a Schwartz Round that have relevance to the wider life of the organisation. And Schwartz Rounds their function is not as a place where people make decisions about anything to do with management or activity of any practical kind. But there's always people in the room who are aware of the conversation and who can take what's been said in the room and what they've learned from what's been said into the work that they do outside of the round in terms of practical issues and management. So that's certainly, we try quite carefully to make sure that the facilitators feel very confident about maintaining the integrity of the Schwartz Round as a place for reflection, not for decisions about action of any kind.
Mm-hmm. Any other comments?
I suppose, Jean here, we use our feedback we put at the end of, every 12 months. And I present it at the board and to our executive council. And really, well, there's many, different ways this can go. But one of the things that I use the feedback for is to promote Schwartz Rounds in the rest of our group, to also encourage, I suppose, the CEO and others who are not so much of the front line to engage in support for our staff. So it's very valuable information. And then our executive team, our HR director, etc., they would go to rounds. They might go to 4 or 5 a year. And it's interesting because they'll come back to me and they'll say, oh, I heard this at the round, and they'll see, what can we do about that? Now, and it's really, what they're talking about really is how can we support the staff in that area or whatever it is. So it's really, it's the data that's collected is really, it is helpful.
One of the questions that comes up sometimes when we talk to sites at the start when they're interested in introducing rounds is the safety and that sense of, do we need to be referring staff to other staff programs or staff welfare programs or occupational health? And it's something that we've talked about a lot and talked about with the Point of Care Foundation and the mentorship that's provided through the Point of Care Foundation. And the conversation comes back to that idea that actually the emotions that we feel on a day-to-day basis are part of our humanity.
Yes.
And it's really important that, and if you're not feeling those emotions, that actually then that's the time you really need to seek help. So there's a piece about not pathologizing that emotion and saying if somebody gets upset or cries, we need to refer them into a program. That is very, very natural and normal. And obviously if somebody was very upset, there are fantastic resources available within occupational health and workplace well-being, that there are supports available there that people can access. But it is very much, I think, that Schwartz, it's not a standalone piece. It's not to say that you'll introduce Schwartz and you fix every single problem in your organisation. And Schwartz isn't for everyone. You can't force people into a room and say, we know this is good, we know there's good evidence, we want you to talk. It doesn't work like that. It's about people self-selecting, being supported to attend them. And then you see the benefits and the ripple effects within your organisation. But there will be other people and there are, different supports available that would suit other people better. And it's about, I think, making people aware of what's out there so that they can select and choose what does support them.
Great, thanks, Anita. There's one or two other questions here from the people online. Thanks a million for, there's over 50 people online from all over the country, so that's great. So any questions, please ask the experts and get typing in the chat box. So Jackie Horan has asked from Galway, from Coast and Galway, about representing services. She represents services in the areas of homelessness, domestic violence and older people. And she's just wondering whether Schwartz Rounds has been applied in these contexts. And I know Joslyn has answered that from a UK perspective. But from an Irish perspective, are we thinking, is there anything happening with that?
At the moment, we've just moved into sort of community and mental health services. This is one of the things about Schwartz and spread of it within the country, is that we didn't go out and actively target services. We want to work with services who want to do it. So people that have come to information days and said, yes, we want to be part of that. And I think there's plenty of scope that if there's a service there that's interested and they want to do it, that they can just come along and they can learn from the experts involved in Blackrock who really supported the programme along the way, and the relationship with Current Care Foundation. So there are plenty of opportunities there to do that. I know that we spoke to somebody earlier on in the prison service and they're very interested in it. There are different, I suppose, areas where if you talk to people who scrape the surface, if you've got staff working together, there's an opportunity to do Schwartz Rounds.
And again, this question flows nicely from it. Therese McDermott has asked about the quality of relationships within teams featuring as a factor or influencer in strengthening relationships between staff and patients. And do panels ever choose to explore this issue, given that the relationships are often interconnected and ambiguous?
Yeah, it's two ways to approach that. I don't think we've specifically talked about teamwork as within a theme, but it is the constant theme that comes up within the substance, within Round, how either people worked within the team or how they felt, and people either being aware of that or not being aware of that. And I think that's the wonder of Schwartz Rounds, because you come away with, most times, not all times, but come away with that real sense of team, often a huge sense of pride in your colleagues, and hearing those personal, untold stories. I think one of the speakers today talked about Tanya Light on her voices. They're just so incredibly powerful, and for me, that's the beauty of Schwartz Rounds, because as a clinician, we're used to do, especially in the hospitals, we're used to doing clinical debriefs, but that's just the clinical team. We never ever include our administration staff who meet our patients, who meet our relatives who are distressed, security staff who help them with parking in the car park, our catering staff who are working in the restaurant and serving the meals. And actually, our chef is our greatest champion of Schwartz Rounds. She wanted to make it compulsory. And we kept having to roll her back. Jeffrey accosted the other consultant one day when he was leaving, when Schwartz Rounds was starting in half an hour, because he had inadvertently booked another meeting, and she was horrified because she thinks this is a unique opportunity that everyone should have access to.
It's breaking down the hierarchy.
So I think there is that collective sense of team and the collective sense of purpose. And I think what people feel is re-energized, having come to Rounds. It's emotionally exhausting many times in that anticipation of Rounds. But would you agree, Jean, it's that, will people turn up? Will we do a good enough job as clinical leads and facilitators? Will there be enough food? Will there be enough room? You know, how will the discussion go? Will we have the skills to share this conversation? And then what will the feedback be? And you come with all those words, well, actually, more often you feel just this wonderful sense of pride, but also energy that actually reminds us why we do the work we do. And that can be really powerful.
That's what it comes back to, isn't it?
It does, yes, it comes back to that. And it's all of those emotions in the one day for Schwartz Rounds, you know, if you're facilitating or leading or even just there running it, it just, yes, you go from highs to lows, but you do feel fantastic after it. Yes, you do.
From Angela Teisel, so interesting, do you ever meet any resistance to the concept of sports? If so, how do you manage it? Is this a group of staff or disciplines that engage more than others in the round? Joslyn, thanks.
Well, I think it's very important to say that attendance at the rounds is voluntary, and that there are some, they aren't for everyone. There are some people who naturally would not wish to attend a round just because of their own personal makeup. I can't say that there's any groups of people who we have ever come across who are resistant, as the person's asked about resistance. I think some people are very sceptical about them, and some people come along because they're curious to see what they're like. I don't think where people say it's not for me that they should be challenged or anything like that. I don't think it's a question of forcing people into them at all or managing resistance. I think it's a matter of kind of creating the opportunity for them to happen, and then letting them become established and grow, and people will come along and they will hear from other people who've been to them about them, and sometimes their attitude will change. And some of the most powerful advocates of rounds were people who started off being very sceptical in the first place. I think there is a big issue about people who can't attend for practical reasons, particularly in big hospitals and in some settings. So, for example, ward-based nurses find it very difficult often to get away for breaks. And that's why with Ashford and St Peter's Hospital, we're beginning to offer training in pop-up rounds, which are kind of mini rounds that can be taken to those areas rather than people having to leave their clinical area to come to the round.
Okay, well, anything to add to that, or are you happy enough? We've plenty of other things to address anyway. I think it might be good maybe to move on to a little bit more about how to get started if you were thinking about getting involved in sports. So just really, what would your advice be around, you know, how to go about getting started?
I think for talking from an organisational point of view and not the HSC or the national point of view, I think the first thing you've got to do is you've got to get your CEO or your hospital manager at the hospital or whatever facility you work in. It's really getting the person at the top to agree to it, because there is a financial, and I know you probably explained that, Anita, there is, you know, you do have to, you know, pay the license, you do have to support staff to go and train, and you do have to provide lunch every month. And I just got the bill there before I came away. Anyway, so, you know, that is a commitment in the climate.
Would you say, though, it's invaluable?
Of course. The cost, for me, I'm a champion, so I have no problem. But I would say, and I'm very lucky, our CEO, well, we were asked obviously nationally, but our CEO is really, really behind us because he sees the value of these rounds, even though he's the accountant, he sees all of that.
So there's actually Trish Joslyn has asked about establishing in an organisation, you start at the top.
You start at the top.
In the brand. That's really good.
You've got to go to them, and I would advise somebody to go to a round. We were very fortunate, our CEO paid for us to go to London to see in the Royal Free, to see around. And then when we came back, we were really, really anxious to...
I'm going to counter a little bit, because I think CEO support is crucial. Certainly our CEO sits on our steering. I think she's only missed 2 meetings in 2 years. But I think you need people on the ground who have learned a little bit about Schwartz Rounds and are passionate about it, who will spread the message, who will go to the CEO and the senior management team and say, look, this is something we need to learn more about in the first instance, and getting that groundswell support to actually build it. Because I don't think you can implement it, and I know that's not what you meant. You can't implement it from the top. It has to be that dual approach, that there's people who know about it, are enthusiastic about it, but also you need the backing of the CEO because of the cost. Not only the financial, but also the time cost. If you think of an hour once a month where up to 100 people, depending on the size of the organisation, are actually away from their duties or, you know, are less available, and what we find in the hospice is we've had to juggle with times a couple of times now, because what we find is that therapists were missing some of their sessions with patients in the day hospice. So they were really, really struggling with that. And for others, it was easy enough to manage our schedule. We couldn't get our nurses off the ward for the hour. We got the senior nurses, and we sometimes got backfilled from our sister site, but that was only very short-lived. And we have done one pop-up round of the half-hour concept, which was very interesting because you don't get a short period of time to open the discussions and then close it down. But it was well attended, and so there is that opportunity of, you know, trying to be more accessible to everyone.
Yeah, I think if you're going to start in your organisation, there's a few pieces that might sort of be helpful to you. The first is the website, the staffengagement.ie website, and that has the information about who you can email. So you can email myself or Orla O'Reilly at the moment, and our contact details are up there on the site. And what we'll do is we can have a chat with you about what resources are available to support you in that conversation with whoever the powers may be. And there is a piece about thinking about your organisation. So like the staff survey results can be helpful to make a case. Like the absenteeism bill under HSE in 2015 was about 181 million. And, you know, incidents and accidents last year, about 90 million was spent on that. So we have, think of the cost pension for an organisation. And the work on Schwartz Rounds has been proven to improve staff engagement. And they say staff engagement measures, it's the biggest measure of organisational performance. So everything, down to how effective you are, how many incidents, how many complaints, all of that stuff is interconnected. So it makes the business sense. The only thing about it is it's a slow burn. So it doesn't happen overnight. And there is a piece of that saying you're building and changing a culture. You don't do it in life. So it can be difficult to make a case for that when you're saying we need this immediately and this is going to take more time. But actually, if we don't start doing that, we're going to continue to try to put out the fires, and we're never actually going to move to that space where the good stuff is happening. It's an investment. There is training coming up for clinical leads and facilitators.
That might answer actually Anne's question.
Yeah.
As the staff training is provided to facilitators.
Yeah. So there's 2 days training provided to the clinical leads and facilitators, but there is a process around how you go about choosing your clinical leads and facilitators for the site. It's not a tap on the shoulder to say, we think you'd be great at that. You might find someone that would be really good, but there is a culture of tap on the shoulder, and that can disengage people straight away. So there is a process, and they used it in Galway, where they interviewed for people and they put out expressions of interest. And the choosing of the clinical lead is actually really important, because you need somebody who is really trusted. And the facilitators need a really high degree of emotional intelligence.
And does the clinical lead need to be a doctor, or can it be?
It's recommended that they are. It's not always necessary, but there's a recommendation that comes out from the Point of Care Foundation that is. And maybe Joslyn, you might want to talk a little bit about that.
Sure. Yes, we followed the guidance of the Schwartz Centre when we started, which was very clear that there would be a clinical lead who was a doctor. And the reason that they would give for that is that sort of twofold. One is that it means that other doctors will recognise this forum as something for them, and that if a doctor isn't prominently displayed, as it were, that they might not feel that it was for them to attend. But also it's to have a doctor who's a real champion to their colleagues for the rounds. I think there are some groups of staff, nurses, for example, who might take more readily to the rounds than some doctors, and so I think that's the rationale for it. We follow that guidance, but it's also clear that there are some settings where doctors aren't very significant or less significant than other members of the multidisciplinary team. So we would talk to each of the sites about what was the most appropriate thing for them. So I think we would say there's a strong guideline, but it's not rigid.
Okay, that's great. We have 5 more minutes, so any burning questions, type them in the chat box. So there's one from Una O'Brien, just asking about an evaluation process after the Schwartz Rounds has taken place. There's kind of 2 parts to the question. Is there an evaluation process, and is there evidence or research undertaken to support the benefits of Schwartz? Yeah? Anyone particularly want to take that up?
Yeah, this is just to say that all of the presentations from today are actually going to be recorded and up online, so you'll be able to hear the evidence that's coming from the longitudinal study in England. That's probably the best one to look at immediately if you're looking for the most current data. It's an NIC source study, and there's preliminary data published at the minute around that, and it's really positive to read it. But it also speaks very frankly about the challenges and what you need to do to maybe think about if you're introducing them. So if you Google that, we will have a link up to that on our website, the staffengagement.ie website, and there's also a link to other papers and other research. And the Point of Care Foundation website is excellent as well, and they have a huge amount of resources easily accessible that shows the benefits of Schwartz Rounds. So it has been in place in America for quite a long time. So they have, I suppose, a longer range of data. We've just started here in Ireland in the last 2 years. So as time goes on, we'll have more. But the preliminary results in particular are showing that 86% of staff in the 2 sites that tested it as a pilot feel better able to care for patients after Schwartz Round. 75% of staff in Galway said they feel more engaged after participating in a round, and over 90% in both sites have said they want to continue to come to rounds and would recommend them to colleagues. You don't get results like that unless it's working. It's really fantastic.
Great. And thanks, Joslyn. You've put in some details there in the chat box for people, a web address. Just 1 or 2 other questions. So, how is a sports round different to a grand round or a balance round or a peer supervision? How does it differ?
So if I take that one, so I suppose in grand rounds it's often around the clinical case and you're looking for solution, or you talk about the process of how you treated a certain case. Balance groups are more sort of individualised as far as I know for peer support. Schwartz rounds are for everyone who's working in a healthcare organisation. And while sometimes the thing could be based around a case, the clinical details are not important. It's how that case made us feel emotionally, how we responded to it. And the discussion, I suppose, is within the rounds is just, you know, our emotional response to our work and what we bring to us and how our work and our life are interconnected. And so it's very different. I think it's really hard to explain unless you witness a round or attend a round. I know there's rounds on the website that you can see, and that really gives a flavour for what actually happens in a round. And there's no other form that I know where you talk about the emotional response of how the situation made you feel.
Maybe a nice follow-on from that would be like a practical example of, you know, has there ever been a sports round that's maybe got a little bit unwieldy, hard to manage? You know, how would you manage a situation like that, if there were people distressed or really stressed out? Or
we often have tears at meetings, because working in healthcare can be very sad. And so we had rounds where we had 2 of our quite prominent consultants, both tearful, you know, they were telling a story, a sad story, and how things hadn't worked out so well for them or the patients. So, but, you know, we managed that. We've also had audience members, you know, share something personal or some story, and they've got upset. But what we do after a round is, obviously, we debrief with them and we support them, and then usually the facilitator or whoever's facilitating the round will go back the next day just to check in with them. But, you know, we've had, like Blackrock, we've had a lot of rounds, and we haven't had anybody that felt, you know, overwhelmed by those feelings.
I think it's really important, though, the training you get from the Point of Care Foundation and the GID department and the support you get from them is instrumental in the success of Schwartz Rounds. There's a very sort of set formulary as to how you run rounds, but also how you facilitate the discussion. And I think as you grow in confidence with running the round, you're more confident in actually shutting down conversations that actually aren't appropriate. So sometimes when we're at grand rounds, for instance, you ask people, well, why did you do that? Or did you think of, and certainly at our last round last week, somebody who was new to rounds started that line of conversation, and our facilitator said, well, actually, no, that's not how we run the round, you know, but how does that make you feel hearing the story that you did? And I didn't do it, skillfully he did it, but at the time, but you become more adaptive because you stick to the rules of how the rounds run, and that gives you, I suppose, an immense support that you do with the right way.
Yes, you're right.
But tears are common, and it's okay. I know people worry about tears, but we work in a challenging, you know, environment. You know, we're dealing with patients who can be distressed, or families who can be distressed, and some of the work we do in our day-to-day work is distressing, and it's just having that form that actually it's a safe space.
And it can be clinical and non-clinical as well.
Yes,
I think that's probably one of the biggest things about it. You can start to see that actually it's much broader than just clinical staff that are affected by this type of work. Speaking of rounds, there is a live round that starts at 2 o'clock, and if we're not in the room, we won't get
So we really better go.
So, just to say thank you very much for, I know there's 1 or 2 other things that have come in there, but thank you very much, Joslyn, for working that out with me this morning and being able to dial in and be here with us today. And thanks very much to our panel of Anita, Joan and Jean in the room, and hope the rest of the conference goes well. And if you have any further questions, I'm sure, Anita, you'd be happy for people to email them on to you and give you a call. Also, we have some links there, the qualityandprinciples.ie and the Knowledge and Skills Guide and the Staff Engagement.ie as well. And just lastly, for all you QI Talk timers out there, so today, 2 weeks, we have Lisa Toland, who's going to do a webinar on microsystems, so hopefully you can all come back and join us then. So thanks a million. We'll sign off from Dublin Castle. Yeah, thanks a million.
Thanks, everyone.
Okay, thanks for joining.
Bye.
Thank you. Bye-bye.
Bye, thanks, Joslyn.
Bye.
Joslyn, we talk soon.